Thank you for joining us. I'm David Voss, the director of HUD's Office of HIV/AIDS Housing, and it's really a pleasure to see you here today. As you know, today, December 1st, is World AIDS Day. President Obama and the administration have made a point to issue a proclamation talking about this important day to reinvigorate our approach in this nation and in the world to fighting HIV and caring for people living with AIDS and HIV. We'll have a wonderful panel today. It's about HUD people who've contributed. It's about HUD partners who've done things in their community. It's about citizens who've used our programs to change their life for the better. And so, again, thank you for joining us. It's a great day. As we work on this epidemic, which is unfortunately continuing, but we have, as the Secretary says, the technology to do something. We have the technology of supportive housing. We know it works. And the question is, how do we make sure it works in all communities? So to begin the program, I want to have Reverend Ganaway say some comments. Thank you.
I would like for everyone to stand, please. You don't have to close your eyes, but I would like for you to bow your head. Father, we come before you right now, first thanking you for the unity of coming together to help the situation of this disease. We know that it spreads by cause of lack of knowledge, but I ask that you help us come together to help not only the homeless, but those who have HIV or AIDS and are homeless also. Give us the ability to reach out beyond ourselves so that we will help others. Help us change this situation. Help us improve the life of those who are going through, as well as give us enough information to teach others to keep them from crossing into that path. So I ask that you bless and keep us, and ask that you give us an ear to hear and a mind to receive the information that's going to be given to us this morning. I thank you. Amen.
As I said, one of the themes is about HUD staff. World AIDS Day is not just about our programs. It's about us and our family, that some of us have friends and family members and loved ones, who we've lost to AIDS, but also who are dealing with it. And I would especially like to remember today somebody who was here at HUD when I started, Albert Sullivan. He was somebody in multifamily who was actually a man living with AIDS. And he talked to Secretary Cisneros on the very beginning and told the group what it was all about and help the leadership of this department in the early 90s understand AIDS in a way that was personal. And from the 90s on, we were able to operate our programs and do a lot with our efforts. But somebody like Albert stood up and talked about it. He later joined the board of the National Association of Persons Living with AIDS and the National AIDS Housing Coalition. And I believe he's passed away now, but he did a wonderful thing, and he did it on his own. Something that was a little bit of courage, but something that then added to the mix. But I also like to say thanks to our secretary, because this year he gave us a special challenge. He said, HUD should be there on day one. Let's look to bring new staff people in our Presidential Management Fellowship program, and also people returning from the Peace Corps in America, AmeriCorps. And he said, and I was privileged to be in that team, and thank the senior leadership at CPD for allowing me to do that. We looked at resumes and we interviewed people, and one theme that I saw is so many people in the Peace Corps had a direct experience helping spread knowledge about HIV and programs to help people with AIDS. It was really a theme. It's also a theme I saw in their volunteer work, in their school, in their personal lives. It was amazing, and we had incredible opportunity, and I'm fortunate to have new people join the team at HUD. And I know there are many people in the building who have joined us who have that experience. So HUD now is enriched with people who have a personal commitment to AIDS, which I think will help us as we go forward in understanding not just this issue, but lots of issues of challenges from healthcare where it's absent. To explain what the screen, the pictures you've been seeing are pictures from Mozambique. One of the people who joined the staff this 3 months ago was Erica Lipschultz. She was a Peace Corps volunteer in Mozambique, and I wanted to have her welcome you today.
Good morning, and thank you for the introduction, David. Thank you to our honored guests. I'm honored to be up here today and share with you a few words about my experience. I recently joined HUD after spending 2.5 years in Mozambique with the Peace Corps, of which were the photos you saw as you arrived. Some are of the hospital, some are of the town where I lived, and the people that I worked with. Mozambique is in southern Africa, above South Africa on the eastern coast of the continent. It has about 11.5% HIV/AIDS prevalence rate, though in some of its cities it's double that. These are pictures of the World AIDS Day I attended there. Mozambique is one of the 15 presidential emergency fund for AIDS relief focus countries, and PEPFAR was implemented in 2003 and committed $15 billion over 5 years, of which the current administration has continued and expanded with the Global Health Initiative, which broadens the scope of PEPFAR to include maternal and child health. With PEPFAR funds, Mozambique expanded its system of medical care in which life-saving medications could be distributed throughout the entire country. While there, I worked with 25 HIV-positive peer educators on treatment care and support for people living with HIV and AIDS. As a team, we were responsible for finding those who had abandoned treatment and try to convince them to return to care, as HIV/AIDS medication must be taken on a daily basis or it can become ineffective. Access to housing was put low on the list of priorities because it was generally accepted that family would take you in. However, this was not always the case due to a variety of issues, ranging from lack of space to stigma. Even with family, access to safe, stable, and comfortable housing was a large problem, and many of our clients were forced to move around, making our job of trying to get them to come back to the hospital difficult. We had a client named Anthony whose situation was dire. He had an AIDS diagnosis and Kaposi sarcoma in his legs, so he was unable to walk. He managed to arrive at the hospital from his village, but had no family in the city and was bumped around between friends and hospital wards, as the hospital wards are not meant for long-term stays. His family refused to come and take care of him and bring him home due to stigma issues, and so Anthony continued to stay in the hospital, being bumped around from ward to ward and failing to get better. Finally, the NGO I partnered with, the hospital, and the local home-based care organization partnered to rent him a house so that he could be stable and near treatment. The peer educators created a schedule so that someone could check on him every day. Anthony began to get better as he continued to adhere to treatment and was able to begin treatment for Kaposi sarcoma as his stats improved. Without a stable home, this wouldn't have been able to occur. And he is one of many cases because Mozambique has no HUD. It has no safety net to serve the most in need of a place to call home. Thank you.
Thank you for that. And, at HUD, we have a privilege of working as a team, but often we work on the thing we're responsible for and don't consider the rest of the team. And I think this last year, we've been especially challenged to stop that practice and to try to think about how the team overall can create successes. And that, I think, is the message a year ago that our Assistant Secretary took to the White House meeting on AIDS housing, the first ever convened at that level. We brought people in, researchers, program persons, advocates, and Assistant Secretary Marquez talked about thinking about that, working together to make the whole thing work. And in addition to our commitment to make the individual tools work, but thinking about the team approach. And I know in CPD we've been privileged to have your leadership this last couple of years, and I know in your prior work at HUD and Fair Housing and working in the Colonias and then in development and the housing department in Los Angeles, you did so many things, including, importantly for us, a special research project on HAPWA. But I wanted to welcome you to the stage as somebody who is continuing that big theme, leadership in teamwork. Thank you.
Well, welcome to HUD's commemoration of World AIDS Day. Buenos dias. Today's theme is building on success. And we'd like to, in the end we're going to, but I'd like to start by welcoming Jeff Singer, President of Healthcare for the Homeless in Baltimore. Receives HAPA funds. He's going to receive an award, over $1 million today, to help us with HPRP and other things, McKinney-Vento. We were talking a little bit before we started about their use of HPRP to help folks with HIV get off the streets and stay off the streets. And that really does get to what, David, you were speaking about. about how to leverage all of the things that we do, all of the money that we have, and to think more broadly about success. And for that, I'm grateful to be here with you today. We've had a lot of success. And I know that when the meeting that David spoke about at the White House, when I spoke to folks about looking at other programs, at the first 5 minutes, folks were a little concerned. I could see the look on their faces concerned that meant a retraction of commitment. And in fact, it doesn't. And I can tell you that in my own professional life, I know that when you really do look at the issue of leverage, you get more, but only if you look, right? And so at some point, we have to agree for just that period of time to not be afraid of what the outcome will be as we analyze what success would look like if we actually partner together. And I think, Jeff, that your organization and the work that you do along with your staff today, I understand that Louise Traherne is here and Shauna Brocht is here and Matthew Walensky are here, welcome, that together you all have the guts to be willing to look at what could happen if you partnered and what could happen if you looked, and partnership takes time. So it's a commitment. But I thank you for doing that in Baltimore and for making a difference there. So welcome today. HOPWA serves over 60,600 households receiving housing support. The Office of Special Needs Assistance Program reports that over 10,900, so really almost 11,000 homeless persons with HIV/AIDS were sheltered in housing as a result of the work that we do and that you all do. That home supports, right, so leverage, home supports over 400 HIV-positive individuals and their families with tenant-based rental assistance. And people living with HIV/AIDS can often utilize and benefit from all of our programs, whether it's being someone who is supported by and, what I'd say, sheltered by, in another way, by fair housing protections, by receiving housing through our affordable housing programs, through public housing, and through other community development. As the stigma of AIDS transforms to something else, it becomes less necessary and perhaps important for the housing not to be segregated, right? It also challenges us because that means that our brothers and sisters living with HIV/AIDS are in our other programs and more difficult perhaps to identify, right? So that as we have success on one end, that same success means we have to work a little harder to identify them and make sure that they get the kind of support they need, particularly if it isn't the kind of support they used to need. Right? I remember in Los Angeles having a discussion when we were funding HIV/AIDS projects about not segregating and how is it that we would spread them across the community and what kind of special assistance would people need to make sure that they weren't forgotten if they took the step of not wanting to be segregated. So that was a discussion I was having, I don't know, maybe 8 years ago, and so now that has really progressed. So we continue to integrate. And today, this year marks the 20th anniversary of the Cranston-Gonzalez Act, which authorized HOPWA, right? I can tell you that myself, and I know that I speak for David and others, but David is part of this. I feel so fortunate to be here with you today, right? For me, I'm a houser. I was a houser before I came. I'm a houser now, and I'll be a houser when I leave and do the next thing that I do. And today, building on success, I feel that I'm standing on the shoulders of 20 years of hard work. And Erica, you're part of that history now too, of 20 years of hard work. We're so happy to have you and others join us because it really is what makes us a true planet, isn't it? That you went and had that experience and brought it home, and others like you went and brought that home. It really does enrich us in ways that are yet to be understood. But as we highlight 20 years, you will help us move forward into what the next level of innovation, which can only come from a heightened consciousness, right? And you bring that. So thank you for coming and agreeing to come into a bureaucracy. It's difficult, isn't it? I say that working in a bureaucracy, working in government, it takes about 50% more to do this work. And those folks who manage a way to carry that extra weight with grace succeed, right? So whether it's your own imaginary wheelbarrow, right, find a way to carry it. because that kind of perseverance and patience is what makes public service work. It has its burdens, but it has incredible gifts. So when you feel that weight, find another way to carry it, right? Find a way so that it feels lighter for you, right? So the president tells us that now is the time to build on and refocus our existing efforts to deliver better results for the American people. And it couldn't be true more than in the SNAP's office. It couldn't be true. It just couldn't be more true. So much work, so much making it, almost work with spit and glue, I think, for some years as you built the kind of recognition and credibility that you all now enjoy. Right, and it couldn't even be clearer now that we've worked on a federal, a national plan on an HIV/AIDS strategy. I was so thrilled to watch as this progressed, and as we were able to be part of a collaborative effort in the White House that ensured that housing was a fundamental stone in this plan. That we weren't just speaking physicians and housers or researchers, that we were understanding that it really does begin in any way you want. You can come through the issue of health, right, and not understand that housing is healthcare, right? We can miss that, right? We can also miss that if we're providing the housing, that connecting the services in a meaningful way is important. So no matter where you begin, we end up in the same place, making sure that the entire person is helped. So we were very proud of that, and I think that the outcome has just been lovely. And I congratulate to the folks at the White House who worked on this AIDS strategy, who brought everybody together and held. It was powerful to watch AIDS activists come to the White House and to sit in that room and hang up their coats. I remember it was a winter day, and hang up their coats outside and all the special IDs and all the things that it takes when you go over to the executive office building. But to be recognized, right, that it's important enough. And it wasn't just myself. I was lucky to go that day, but others in the White House, in the urban agenda, that were there all together to listen and to assist and to help coordinate. So in the end, just beautiful work. And we continue to do that. Housing, as I said, is healthcare. It's also the foundation to a better life. It has been shown in study after study. I will tell you that when I was asked when I was in Los Angeles to be one of the 3 agencies that tested, can you imagine, a study on whether housing helps people with HIV/AIDS. Really? Okay, but you have to have a study for that? Evidently, we did, and no surprise, it helps. So here we are, now also tying in these efforts beyond a federal AIDS and HIV strategy to our national homeless strategy, another incredible piece of work that was done this year that integrates all of these issues, that understands the importance of leverage. And so to Mark Johnson and your staff too, that separately worked on that, and to my colleague Fred Carnas, who have been so sensitive to ensure that all of our issues are there, right? That we didn't have to have a special meeting for folks with HIV/AIDS to be involved in that plan, right? We have come this far that we now know. And I think it is due to the efforts, not unlike those of the gentleman that you spoke of, that had the temerity to speak to a wonderful secretary, Cisneros, and discuss his personal story with him. And so these things all now reverberate in the building. They live within the skin of the building, the one that is beautiful that you can't see. So here we are. But as we transcend the way that we do business, as HUD works on a strategic plan, as it's in our map, as we talk about a platform for housing stability, we will continue to work to link our clients. And I would say one thing to you about that. Who are our clients, right? I will tell you that for this HUD, our clients are the people who need our help. And when you define your question, you get a different answer, right? If our clients are only those that we sign a contract with, you all know that that changes, right? When you sign a contract with the state of Maryland or the city of Baltimore, if they only see you as a client, the discussion is one way. When you bring, right, your clients to the table as equal partners, what is in that contract changes. How you do your work changes. And for us, that is the same way. When our clients are people who need our help, the way we think about our outcomes change. And that's one of the beauties of being here today. It's one of the great things about working with Secretary Donovan, who never forgets that, right? And who's had the foresight to surround himself with other political appointees who share the same vision. It's not everybody who would hire a civil rights lawyer to come run CPD, right? It's not everybody who would take that risk. And find out that maybe we're not so nutty, and that maybe having done practitioner's work is a really good foundation stone for solving a problem. So I'm always grateful to him for taking that risk and for surrounding himself with other wonderful partners for me to work with on a daily basis. So that's what we're about. And we're going to evaluate our results so that we can continue to make our case. If we can't show what we have done, it is so easy later to say maybe you don't really need that level of funding or more funding, right? Or different funding. Or maybe the rules changed to accommodate real change. So evaluation is important at the basic level for that reason, right? It helps us make the case and helps us step away from our own personal kind of subjective views to say this is what really works. And that's why I'm so always happy to work on those evaluative tools, because it's something that even when we're not here, right, it continues to be true, particularly if we're tied to real outcomes. So we're here to recognize our partners in Baltimore, Healthcare for the Homeless. Your efforts exemplify HUD strategic goals in using housing as a platform for access to care. Your model in Housing First, our model in Housing First. It offers mental and substance abuse to serve populations in downtown Baltimore, right? I come from LA, the biggest homeless population, right? I understand what that looks like. I understand how hard it is, and I know how hard it is, and how for all of you that do this work, how important it is to have another outlet when you come in and you carry someone's burden, how important it is to have your own way to let it go. Right? So we thank you for all of that work that you do. We know that you use the funding, the HOPWA, SHP, McKinney-Vento, HPRP, as well as SAMHSA, Ryan White. Those are all of the things that together make for a spectrum of services that have true color and true beauty, and that actually work to keep somebody off the streets, maybe for forever, because of the right kind of intervention. So because you provide holistic care to clients, you serve over 6,000 individuals a year in Baltimore City, 12,000 in Maryland with wraparound services, mental health, substance abuse counseling, educational opportunities for your residents. I also understand that you initiated a dental care program for persons experiencing homelessness in Maryland. And we know how important that is. How are you going to get a job, right, if you can't present like you could come to work? So these very simple things are so key, and we thank you for all your contributions to the city, and as a result to our country and to the world. So we look forward on building on our successes, and it's with great pleasure that I introduce Jeff Singer, someone who's doing this work every day in our country to show the way about what change really looks like. So thank you very much, and welcome to HUD today.
A little.
This is the secretary's going to hand out money.
All right, here we have it. It's a small check
Small check. Here we go. Right?
to Healthcare for the Homeless. It's $1,265,000. Represents. It represents 3 more good years of work.
Well, we'll do our best. We'll do our best. Thank you very much for this extraordinary opportunity. It's really an honor to be here with you all, to the Assistant Secretary, and to David Voss, who's always been a friend, Mark Johnson, and of course Fred Carness. It's wonderful to see you, sir. In 1982, a man who was very sick and very weak staggered into the homeless unit of the Department of Social Services. He had nowhere to stay. He had no friends. He had no help. And fortunately, we put him up in a motel for a few days, and then we found a program called Project Place that was willing to accept him, an emergency shelter. They took wonderful care of him until Mr. Doyle passed away, not long after that. And we learned that Robert Doyle was the first person in the city of Baltimore who was known to have AIDS. And it was no accident that he was at the homeless unit, because the two epidemics of homelessness and HIV have grown up together, unfortunately, at the same time, beginning in the 1980s. What a decade that was. Jane Fonda workout tapes were brought to us by the 1980s. Morning in America, the conservative revolution, was brought to us in the 1980s, and these two epidemics. They were fueled in part by the devastation of this agency. The budget of HUD was cut from $32 billion in 1980 to $9 billion in 1990. No wonder that millions of our friends, relatives, and neighbors were sleeping on the streets. There was no housing for them. Now, fortunately, of course, we began to organize to change those conditions. And that organization has produced the McKinney Act, which funds so many of our programs, and the Ryan White Care Act, which funds so many of our programs. The community health centers have been strengthened under various administrations. So we now have a good set of services that enable us to go out on the street, to get people off the street and back into the mainstream. And we've proven that we can do that. But we can't do it without enormous resources, and it takes partnerships to create those resources. Partnerships with HUD. We use half a dozen HUD programs, from housing choice vouchers to public housing, to SHP money, to the HOPWA dollars that not only pay for our services, but actually pay for housing costs, to the new HPRP funds, which enable us to get people right off the street and into their own apartments. And we're paying their rent. It's amazing. We finally realized that ending homelessness means providing people with services and getting them into permanent housing and keeping them there. And with these partnerships, we're able to do that. That agency that was willing to take in Mr. Doyle became our partner in this program, and they now have 5 beds for people who are critically ill with HIV and AIDS, and permit them to live with some dignity and to get the support they need. So you're supporting that partnership as well. We could not do this work, we could not have our successes without these extraordinary relationships, both public and private. And we are really so pleased to be able to continue this program because of your generosity. Thank you so much. And to put a fine point on this, let me bring up to the podium someone who, in fact, has benefited from this program, and we have benefited from knowing Mr. Matt Walensky.
Okay, I was supposed to say a few things. I do have HIV, I do have AIDS. I got them in the 90s. Without HCH, these people here, I was getting in trouble. I was homeless. I was taken from the community. Just living a life on the street for years. I burnt all my bridges, and healthcare for the homeless constantly, the workers there constantly came and got me. Never gave up on me, even when I screwed them over, lied to them, stole from them, did everything you could think about to them numerous times, not once or twice, numerous times. But thank God they never gave up on me, because now I'm standing here with AIDS, healthy, have my own place, ready to go back into the workforce and start giving back, hopefully real soon. And without them, I would not be standing here. I'd either be in prison, dying of AIDS, and Lord knows doing what else. Alcohol, drug abuse, that all comes along with the homelessness. And they had a lot of things there. I'm losing my train of thought. A lot of like NA meetings, AA meetings, different types of support groups that really helped me out. And the counselors were just fantastic. They just didn't give up when everybody else gave up. Healthcare for the homeless, their counselors, the people there came and got you, pulled you back, kept pulling me back. And I don't even know why they did it, because I wouldn't be able to do it myself. If somebody kept screwing me over, it's like, well, shit, crap on you, see you later. But they just kept coming at me, and now I'm standing here, and my whole life has changed. I have housing now. I have housing now. I'm clean. I've been clean for over a year. I have a home group. And I'm giving back a little bit now. I do a few things to give back a little bit to the community. So, and I'm very grateful. And basically, that was about it.
Thank you so much, Michael. Well, and thank you for those that talk, and for the journey here and the good decisions you made in your life too, because that's part of it. And one of the things we've been finding, and we're working in our program to do more of, is listen to the clients, to talk to them and make sure our projects talk with them. There are other things I was going to say, but we have a great team here. The plan that we have in place for HUD involves us in a way that has never been done before. Housing as a platform to improve life and health outcomes. All of our programs are going to be looking at that in this next year, and it's just going to be exciting. For HOPO, it's always been kind of the thing, housing and health, and to work together in the rest of HUD. I've already talked with more people in HUD and other programs than in many years around here. Service coordination and public housing, all this. This is going to be a tremendous amount of teamwork, and it takes some energy. But I think the result's going to be this kind of story. People don't give up on the clients who need our help. So thank you again for your commitment to being here today and the work you're doing. I would mention a couple of other heroes that I have this year. People who just did their job. And the person I have in mind is named Angelo Tom. He works in San Francisco. He's in financial management. And he helped the HOPO program by looking at our new training tool on financial management. And now we're going to, in a few weeks, launch our first ever web-based training tool for all of our grantees to understand an important and vital building block to making sure they control the money in a way that's accountable and in a way that they have knowledge. And this is a big challenge for our grantees with the staffing changes and everything. And thank you, Angelo, for that work to making sure we have a product of high quality. And let me thank all of you too, because I know in your work you're trying to make the HUD product a product of high quality. And together we'll get this job done. So again, thank you for being here today, and have a great day. Thank you.